Our next task is genital warts in a 15-year-old. Genital warts in a 15-year-old. In this particular case, you're an FY2 in a GP surgery. Sandra, aged 15, has made an appointment to see you. Okay, so she has come to the GP surgery today because she has noticed some swellings in her private area. She has got some swellings in her private area. She noticed the swelling about a week ago. She is in a sexual relationship, but she does not practice safe sex, meaning she does not use the condoms. Her partner is 33 years of age. It is a consensual sexual relationship, so it means it is consented. They have been together for the last 6 months. She has come in today just to get the swellings sorted out. So when you look at this particular task, there are two things. There is the warts, genital warts, which is an STI to treat. And the second one is a partner being 33 years of age, which means this is an abusive relationship or illegal relationship. And the two things in here we need to address in this task. So let's look at an approach. So grips as usual. History of the presenting complaint, which is the swelling in the private parts. The differential diagnosis of swelling in the private parts. Then the PLAB of the eyes and the effects of symptoms on a patient. So let's start. History of the swelling. We're going to be asking, when did you notice the swelling? What does the swelling look like? And how many swellings have you noticed? How big are the swellings? What's the color of the swellings? We need associations, associated symptoms. Is there any bleeding? Do the swelling bleed? Are they itchy? Is there pain? Okay, dysuria, any pain when passing urine, frequency, do you pass urine more frequently than usual? Okay, good. So you guys, when asking these questions, make sure you stay focused asking about the presenting complaint of the swelling as well as the associated symptoms of the swelling. Then we need to ask a sexual history, because in the private area, are you sexually active? Are you in a stable relationship? Is your partner male or female? Do you practice safe sex? By this I mean, do you use condoms? How old is your partner? How did you meet? How long have you been with your partner? And what kind of sexual intercourse do you normally practice? Oral, anal, vaginal sex. Now that you have noticed the partner is above, is of course far much older than her, you have to ask about abusive relationship. How are things with your partner? Has your partner ever forced you to have sexual intercourse when you did not want to? Has he ever been abusive to you in any form? Okay, maybe verbally or physically or emotionally. Okay, then you raise your concerns about the relationship. So you're going to say your partner seemed to be much older than you. How did you meet? Yeah, your partner seemed to be much older than you. How did you meet with your partner? Do you feel comfortable in your relationship? Have you ever got consent, or do you ever get consent that your partner may be much older than you? And do you ever worry that your relationship you are in could be a wrong relationship because of the age of your partner? Do you ever worry that the relationship you are in could be a wrong relationship because of your partner's age? Have you ever thought that there could be something wrong with your relationship? Ask about the parents. Do your parents know about your relationship? Do your parents know that you are sexually active? Is there any particular reason why you have not discussed or have not told your parents? Do you ever worry how your parents would react if they were to find out about your relationship? Yeah. Do your parents know about your relationship? Do they know that you're sexually active? Is there any particular reason why you have not informed your parents? Do you ever worry how they would react if they were to find out that you're in a relationship with your partner? Then ask the rest of the history. PLAB, medical fit and well, regular medication, anything else, any traveling abroad? No. ICE. In terms of the swellings in your private area, have you thought of what could be the cause? Have you thought of anything that could be the cause of your swellings in your private area? And is there anything in particular you are worried about? Ideas and concerns. Examination. I need to examine you now, okay, to have a look in your private area, okay? I also need to perform what we call a speculum examination, just to have a look, of course, inside your vagina to see if you've got any other swellings inside your vagina. You need to have a look in your mouth. Oral examination is important. Then you're going to get a picture, and that's the picture we get. What does this picture show? It's warts. As you can see, they are scattered in there for us. Yeah, good. Now, once you see this, the warts, then you get a diagnosis that this is a warts, and we know it's an STI. We're going to be to the point. What you have is what you call genital warts. Okay, a common way of transmission is sexual intercourse. So genital warts are commonly transmitted via sexual intercourse, but they can spread via direct skin-to-skin contact. These lesions are benign and they do not cause any symptoms. So all, which is the same in this patient, only the swellings, nothing else. But it's a sign, it's a sexually transmitted infection, and because she does not practice safe sex. Management. Explain that we're going to refer to the GAM clinic, that is a genital urinary medicine, where she can be tested for STIs. Ask if she's comfortable. If she's not comfortable, go to the GAM clinic. We can test her and manage her in the GP. Other treatments. Explain that treatment for the warts. Yeah. So it may be treatment of warts. Okay. So here you can explain that in 30% of the cases, warts may disappear spontaneously within 6 months. Okay. In 30% of the cases, disappear spontaneously within 6 months. So what you can offer, you can offer topical solution or topical cream to apply to the warts, to the warts. Yeah. A topical cream, for example, photophylotoxin. Do not mention the names. Just say, I can prescribe you some topical cream to apply on the what? On the warts. Okay. Now, just need to know other methods in case you're asked. You can use cryotherapy, excision to cut them, remove, electro or cautery. But the best in this case is offer creams. Okay. So what cream? You may be asked, what cream? Only give too much details if you are asked. The cream here we said is photophylotoxin. Okay. Cream, which they're going to apply. Usually you apply 3 days in a row. Then you take 4 days break, then another 3 days in a row, then 4 days break. And then so you're going to have 3 days courses, 3 days, then break for 4 days, 3 days, break for 4 days. And you need to make at least repeat up to a maximum of 4 3-day courses. Yeah. 3 days, 4 days break, 3 days, 4 days break. Make at least 4 courses of such. Yeah. And then arrange a follow-up in about 4 to 5 weeks. So offer a cream. Okay. Or do phyllotoxin cream. Okay, to apply 3 days continuously, yeah, twice a day. Apply twice a day for 3 consecutive days, then take 4 days break, and then repeat the process again until you do what? About 4 courses. So we're going to arrange a follow-up in about a month time after she has completed the 4 courses. Okay, what other advice? To use condoms to avoid a sexually transmitted infection. Advise that the partner needs to be tested for STIs as well. Okay. Now, for your own knowledge only, cryotherapy, excision can be used. But in this case, because we have seen how these warts looks like, they look quite flat in here. So application of the cream may be the most appropriate. Okay. Then we have to address the sexual abuse issues. Explain that there is a big age difference between yourself and your partner. Okay. Your partner is also a teacher. Your partner is a teacher. He has got authority over her. Yeah, he occupies a position of trust. He holds a position of trust, and he has got authority over her because he's a teacher. As a result, it's not a balanced relationship. So people in certain positions like teachers, sports coaches, or ministers of religion, they hold the position of trust, and they cannot be in a relationship with the people they are looking after. Otherwise, it will be abuse of their position. This is why the relationship is wrong. So again, why the relationship is wrong? Explain that because of the age of your partner is much older than you, and you're under 16, and he holds the position of trust. This is why this is not the right relationship. It is not allowed. It's not illegal. It's not a legal relationship. So explain that as a medical professional, you are required to inform the authorities that include the social services and may include the police as well. Okay, I advise her to discuss with the parents. If she has a problem discussing with the parents, say, offer to explain things to the parents, explain that it is a duty of his partner to know that such relationship, they are not allowed, and it's not her fault. It is the partner that should have known. He's far much older than her, so he should have known. You're going to explain that you're going to take a second opinion from your seniors about the situation, and then you may see your senior may want to speak to her as well. But as medical professionals, you know, you are required to report to these things to who? To report the things to the social services or child protection services, to the police, okay? And the partner may get into trouble. Thank you.